So I'm going to start right now. Thank you. Welcome to all our listeners. Welcome, welcome. My name is Carol Sutherland, and I am the Vice President of Services and Finance for Continuing Education Students Association of Ryerson, CESAR. I will begin with a land acknowledgement. Toronto is the dish with one spoon territory. The dish with one spoon is a treaty between the Anishinaabe, the Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the land. Subsequent indigenous nation and people, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. This is the first of a six-part series of conversation. Today, we will be discussing poverty and health among young people. Our conversation will address poverty, lack of housing, access to equitable medical services, and the impact on the most vulnerable in our society. I would like to introduce Dr. Pria Nippak by reading her bio. Dr. Pria Nippak is Associate Professor and Director of the School of Health Services Management, HSM, at Ryerson University. In addition, she is the Academic Coordinator of Health Informatics, Health Studies, and Health Services Management Certificate. She oversees the capstone practicum in the HSM degree program, which provides her with many opportunities to support students with their career and competency development. Please join me in welcoming Dr. Nippak. Welcome. I will start by asking you the first question. And the first question, doctor, is millions of people lack food security and healthcare, some intermittently due to varying degrees of poverty. Can you use some examples of how this pandemic is widening the gap?
Yes, actually, very good point. Particularly in youth, we're seeing actually over the course of this pandemic, the same issues that you've identified with both health and poverty. We've seen the increase significantly in terms of the gap between service provision and service access for people who are in that demographic group, but overall, with regards to health and increased poverty. So what we've noticed is there's been significant barriers that have arisen with regards to accessing services in healthcare. So we haven't been able to get into the hospital to get the services that are needed. Wait times have been excruciatingly long. Access to even things like testing. We haven't been able to get access to sufficient testing. And this is particularly true because we see that there's this commingling of health and poverty, in that those who are suffering the most in terms of equitable access to services, they're having equitable access to services that are related to health and those related to food security. So, and housing, right? So we're seeing that there's this intersection in that those people who have those dual limitations suffer the most. So.
Thank you for that. This is a lot to take in with, between the impact of poverty and health. It's a big combination there. Thank you for that. The other question is, what barriers does COVID present to how community members have access to food? How does social justice address these issues?
So I can speak more to the ways in which we've seen this pandemic restrict access to food. Clearly seen that food security, like I said just now, there's this commingling that occurs with poverty and food security being one of the largest limitations in terms of access. And we're seeing that in all age groups, that food security has become increasingly more fragile for people in low income groups during this pandemic. And we've seen 3 to 4 times increase in terms of need over this pandemic period. I tried to gather a little bit of statistics around this. So around June, we surveyed around food security, specifically not looking at youth, but they seem that almost 1 in 7 people, Canadians right now, is suffering from issues with respect to gaining access to food. And this does not include food necessarily that's deemed to be healthy. So we see that while we might have 1 in 7 people suffering from being able to have access to food, it's greater in terms of the people that will have access to healthy food options. And we're seeing this is particularly true in the Indigenous population, where we're seeing that those levels could be 2 or 3 times higher than they are for the national averages. And during the pandemic, those have doubled. So now we're looking at things that are 4 to 6 times greater access to healthy food options. And the reason why I say it's important to focus on the type of food options, while Statistics Canada only measures, do you have access to food? They're not measuring whether you have access to healthy food options, is because it relates back to health. Right? And we know that people fare better in terms of the protective precautions that are necessary against COVID when they're able to have access to healthy food choices, right? So we also see that food insecurity definitely has been on the table in terms of an issue long before, but it's become an increasing, like between May, it was about 14% of the population. And then as we've seen, we go through the pandemic, it's Statistics Canada is reporting that it's on average now 20 or 30%. So.
Wow. So 1 in 7 people will be suffering from food, security. That's a big number for um for a country. Was that statistics before the pandemic or
No,
during the pandemic?
This is during the pandemic. Typically, what we see is that rates are now about 15%, and climbing to closer to 20, where they were sitting at about 9% of people were suffering with food security issues. Before the pandemic, Statistics Canada did a similar survey in the 2017-2018 year, and the comparable statistics were about 9%. And now we're hovering between 15 and 20.
My God.
So we're looking at double for sure, if not more. And again, this is just access to food. This is not healthy food options. So we're clearly seeing that those numbers will be even higher for healthy food options, because they're even more difficult. Perishable foods, a lot of healthy foods are perishable, and they're even more difficult to access through the modes that we're using, which is food banks. And find that there are a lot of non-perishable items. So then you're not going to get access to fruits, and you're not going to get access to sufficient levels of vitamins from those things that you get, which are berries and fruits. You're not getting those things when you're suffering from these kinds of food security issues. And we're not even surveying how many people are suffering in this way. We're talking about non-perishable foods right now, the stuff that's not considered healthy, but sustenance, just bare sustenance. And when we look at that, we're seeing it's hovering at about 15 to 20% of Canadians are reporting food insecurity. So that's extremely alarming.
It is. It's quite alarming. And is this by neighborhoods or region? Are we seeing more in certain provinces to some in comparison, or it's just escalate? I know you spoke about the Indigenous people. Really, this has been hitting, and I know with all marginalized community, it's more so than others. So so my question, probably, and just for my own curiosity, because this is a really big concern.
Totally, it
is. Are we seeing region by region a more increase?
Yeah, so what we are seeing is that, even when we look at children in Canada,
Yes.
So stratifying by age as one variable, because we can look
Yes.
at different groups, and one
Yes.
special group would be youth. And
Mhm.
when we look at the 18 years and older, it's 8% in Canada during the pandemic right now. The same survey that was done through Statistics Canada identified that about 8% of children 18 and younger are suffering with food insecurity or food security issues. And then we see that there's a higher rate of food insecurity being reported in Canadians that live in households with a child, so versus those that are living without a child. So when we looked at the commingling of, I guess that would be a representation of a family, so living with children, it's about 20% of Canadians reporting insecurity, food insecurity. And then we see that when you don't have children, it's only about 12%. So we're saying that families are particularly at risk as well. And then we
Mhm.
see and then we're looking at employment. Employment's a huge issue. People that are most food insecure are those who have threatened employment right now during the pandemic,
Yes.
have been identified as having transient or not continuous labor. They're about 30% versus those who are continually working are only about 10% are reporting any food security issues. So we're definitely seeing that there's this commingling again, where people who are in the most vulnerable categories
Mhm.
are also the ones that are suffering the most. And our data showing that. So very, very, very clearly.
And
How's
this is
yeah.
wow. This is very alarming, and also so just recent since the start of our pandemic, um our food um good food center on campus is closed. And a lot of students we had, we used to service hundreds of people on a monthly basis, used to come to our campus to pick up food. And when we had saw that the curve was, going down with the cases, we had an opportunity that we could have opened it, even if for a month or two by, strict regulation. And that did not happen. And I'm always worried about our students because now all of which is a big issue, students have asked for the food bank, the undergrad student. And for some reason, we were happy to do it, but it belongs to the hand of RSU, the undergrad students, and they did not push to have the food bank open. And I'm wondering how, by you saying these alarming numbers like 15%, 20% youths under 18, this is very, very concerning for our student population that we don't know where they are.
Yeah, well, because you could be looking at about 1 in 10 students, right? And that would be
Yes,
considered a very, let's put it this way, conservative figure
yes, yes,
is requiring this because if we look at the intersectionality of some of these students also being identified as special groups or having racialized groups or racialized representation, then we could be putting it at 2 of those people. 2 of 10 of those groups of people could be
mhm,
suffering with food insecurity right now. So clearly, you identifying this problem at Ryerson is one that we're seeing across the boards because so many different areas where people in local communities were getting access to food, those opportunities shut down because of the COVID restrictions. And so this is why I think we've seen, and that's why I thought it was important to look at how it's
yes,
escalated. We don't even have data for September where things have really shut down. So as we progressed into the second wave, we've even more stringent precautions being taken. So even some of the places that did open up, like you said, when our numbers were a little bit safer to allow that
yes,
over
yes,
the summertime, they have now closed again. So the expectation is that many of these people who were without income in May when the study was done and reported in
yes,
June,
yes,
that now we've doubled that. So our unemployment has doubled. Our labor force is further threatened. And
mhm,
again, it's these compromised communities, right? So while continuously we'll see that people who are not in vulnerable sectors or vulnerable groups, they've continued to progress through the pandemic rather unaffected. But as we see that these groups of vulnerable individuals get hit with things like food insecurity alongside unemployment, and this escalates in terms of the number of people that join that group as we move into the fall and the winter, those numbers are going to go so much higher. And if we were to stratify by all of those, which Statistics Canada didn't do in this particular study, they just looked at families, they looked at young kids. But if we were to stratify by all of those other variables, we would see that the numbers are significantly higher in all of these special groups and populations, right? So racialized minorities would represent a much higher a number of people who are food insecure relative to the national averages.
Mm. So this will lead me right into my question here, the third question. And how can we address the inequality in our healthcare system? Do you have any statistics that you can share with us? Because now we see in health, the food is going to have a very big impact on health, right?
Yes.
Especially access to good food. So what are you seeing in these?
Well, what we're seeing is, and clearly what's been reported in even
Yes,
news outlets recently, like CBC for sure has reported that among minority groups. So what we see first is
yes,
that by region, there's
yes,
variation with regards to the presence of COVID-19. And so we start there. And so we're seeing that in areas where we see far more racialized representation, and far more people living in low income shared housing, communal housing conditions.
mhm,
That's where we're seeing the highest rates of COVID-19, whereas we're seeing that in, in single family households, in higher income areas, far lower community presence of COVID-19. So we're already seeing that where you live, which
yes,
is tied to your racial representation and your income, is also tied to the representation of COVID-19. Then to add fuel to the fire, so in Peel region, we're seeing numbers that are very similar to those in Toronto, where we've got tons of demographic
yes,
variation with regards to representation, but we see similar numbers. And Peel is overrepresented by people who are racialized and people living in low income groups,
yes,
right? And so then we're seeing this scenario, but then to top add insult to injury, we're also seeing that there are fewer access or less access to testing. So that was something that was identified just this week, that in these areas that are low income,
yes,
high
yes,
risk, high threat, they're not able to gain access to testing facilities and testing sites to have suitable or adequate testing. And then, so that's the first barrier. They can't get tested, so they don't know they have COVID. So then they continue to spread COVID, right? That's what we've been saying
yes,
all along. In order to get this under control, we need to have sufficient testing numbers. Well, we don't have it in these vulnerable communities. And then on top of it, they're not getting tested or insufficiently tested, which is going to allow to contribute to the spread. But we're also seeing that when testing positive, they don't have the same opportunities to come off of work because they're working in vulnerable sectors, right, where they don't have permanent jobs, they don't have any job security, they don't show up, they don't get paid, despite the government's mandate from across the province to provide 10 days to any sector, to anybody in any condition, they're still not reaching these people. So these people are not being able to access what the government has laid out in terms of supports to allow people to stay at home during that period where they're most vulnerable and at risk for spreading COVID if they test positive. So they go to work and then they
yes,
further spread COVID. Then we're also seeing that it transcends into other sectors as well too. In these lower income racialized representative groups, they're working as frontline support workers. So they have to go to work, which requires them to use the school system. Their kids can't virtually learn, which adds increased risk. So they're in the classrooms and then they're bringing COVID into the classrooms and having to have themselves be removed, right? Because in the schools we are testing. So what we're seeing is that there's education threats and risks because these people are in these vulnerable conditions. And in
mhm,
addition, we're seeing that there's risks to their overall health and well-being. And access to suitable care, we're seeing far fewer healthcare. So one of the reasons why they can't get
yes,
tested is there's not suitable testing sites for them, like a sufficient amount. So they're doing
Yes.
pop up. So in response, the government has now created all these pop up testing centers, which are literally like these tents sitting
Yes.
inside of hospitals or community
Yes.
centers. But the other thing is that GP access is the one route now to get tested. You have to be recommended for testing, right? So you have to
Right.
call your local GP. Well, we know that one in every three individuals who are considered vulnerable groups of people, they don't
Yeah.
have a GP. They don't have a general
Oh
practitioner.
my gosh.
So they don't have a route. So they're using some kind of transient model where they're going to a walk-in clinic. And the availability of walk-in clinics and how many people they're seeing, everything's been so severely restricted. So there's
Yes.
so many barriers to people being able to just go through the steps. And this doesn't include them using our healthcare system, where we have traditionally seen there are enormous barriers to adequate service provision. We've
Yes.
seen ridiculous amounts of discrimination experienced and reported. I mean, over the summertime, and actually towards the fall, we just had this reported Indigenous woman who died in Montreal, right?
Yes.
This is not a scenario that is a first time incident. It was probably the first time it's being publicized because they had actual evidence of it, but it is by
Yes.
far not the first time someone has been treated, disproportionately poorly in a healthcare environment and not received adequate services while they're in healthcare, being racialized, right? So we definitely know that exists. So, but with respect to the pandemic, it's added a whole other layer. And it's kind of brought it out
Yes.
to the forefront. So everybody
Mhm.
now can see it, right? And everybody, is running to try to justify and running to try to fix. But this is such an ingrained, like, I mean, it goes right to regional representation where people are
Yes.
located. We can't change all of this overnight, right?
Right.
And it didn't happen
Right.
overnight either.
Yes. Yes. Um, and this is so for me, I'm always every time I think about these things, I'm also thinking about our students. And we had a healthcare uh, healthcare services on campus that our international students and our students had access to doctors and and um, making sure that they could have come in and get tested and they could have got health. But now it's because, and it's a big department. It's a department that I have used when I was a staff, used sorry, used when I was a student, and it worked well. But now with the pandemic, and we have they have restricted hours, and students, I get an email saying, well, I can't get into the walk-in clinic to see the doctor. I can't get in to see Ryerson doctor. I can't get into my walk-in clinic in my neighborhood. What am I supposed to do? And I don't want to go to the emergency. And I I'm wondering how how could we help our student more in a time like this? Because the and why I asked that question, um, even to get a flu shot,
Oh,
it become very difficult.
vaccinations right now, they are so low. Like in some areas, they've reported that they're less than 50% what they would be this time last year. And this is children, young children, and this is again in vulnerable categories. We see even a higher rates of failure to vaccinate. So while we're concerned about COVID right now, we have this sleeping issue of people not getting their measles, mumps, rubella, their basic first 5 year vaccination protocol. They're not getting access to it this year. So those kids are going to be off the mark to begin with. And then further vulnerabilities will surface. But to get back to, sorry, when you hit me with vaccination, I can't tell you how many people in low income areas have not been able to get the flu vaccine. So despite the fact that they've tried to roll out services to areas that are associated with the retail industry, so they've put them in Costco's because they said, okay, people of all backgrounds will be able to access a Costco, and they have got a
Yes,
free flu clinics. But they're so limited because they're membership based, or they're
yes,
located in, again, affluent areas where we
yes,
don't see people of low income going. So when you say to me, what can we do for our students? Well,
yes,
if we're going to close our services here, then we have to provide them with alternatives. So
yes,
somebody's got to be surveying the community to determine where can they access services, where can we advocate for our students to be able to provide a pathway to those services, like vaccines, like being able to see a GP to get a referral to get a COVID test. And we should be allowing our students or providing our students with the knowledge to know where sites, pop-up sites have been set up so that we're getting sort of regular updates, right? The student groups should be getting regular updates. If we close the service here in-house, then who is supporting our students in this capacity? And how can Ryerson support those avenues that are remaining open? So for example, you went back to the food banks, right? So we might not be able to offer, but how can Ryerson help support a local food bank that has remained open and provide an avenue to provide that kind of support to students? I mean,
Right.
you know,
Right.
there's an infrastructure, even in this pandemic, there are
Yes.
available services, but the problem is people don't know where those services are. And similar to what we see with navigation
Yes.
issues in healthcare,
Yes.
we have to link those people with those services.
And I'm really glad that he did it because our our staff. So what I saw at CESAR is the equity campaign manager came up with a team to look for area resources that students could go beyond the walls of Ryerson to
Okay.
see if they could, this is what we have. This is so they put this whole resource link together, and I think it's continued to be updated as information come. But I'm always concerned about who have access. This accessibility to me, I mean, we had to do it, and I'm really, really glad that we were really leaders to make sure and have those resources linked for our students, because I mean, we service in over 16,000 of our members, so we really supposed to be there and give them we are still, so that's why we still have our services running. CESAR still continue to do the work that needs to get done, even more so than ever now is it during this time. So there's a stability within our membership, and that is good to good leadership, good governance. But I'm always concerned about who have that access, who know where it is, who know to find these links.
Well, they don't.
You
That's
know,
right.
and
We not just
yes.
our students, but in the general public, they're saying right now, identify 311. Everyone call
Mhm.
311. Because right now they're setting up pop-up services and they're changing from week to week that they're like,
Yes.
we don't have a centralized platform that we can send everybody to with the most updated information. So they're like 311 because daily 311 is getting the reroutes, right? This center
Yes.
closed, this one reopened. But 311 isn't a suitable triage sort of network because it's too broad and many people will just not bother, or the wait times for being able to access somebody through 311. So,
And I'm so glad you bring up 311 because my girlfriend is a call center manager for 311,
yeah.
and the amount of staff burned out is
Oh,
unreal.
well, yeah.
So they're giving them as much as people want to come to work and really do the extra hours and get the money, because so many family members in their own family is losing jobs.
Hmm.
So they want to do, but they're reaching the capacity of burnt out. And so many people are calling as a next level. It's like, I feel that I'm going through a mental health breakdown, or I think I want to kill myself, or whatever it is. And 311 cannot handle the capacity of calls that keep coming in and coming in. My girlfriend is always sick now. It's like a buddy keep fighting.
Well, because you're not calling 311 anymore and telling them that there's a dog barking in the backyard 3 houses down. You're telling them that you've just been kicked out of your house and
Yes,
you're living on the streets and you've been on the streets for 2 days trying to get through to 311 to see if there's any shelter support service because your local shelter is full. and the
Yes.
stories that she must be exposed to
Yes.
are nowhere near what 311 was set up to. They haven't, 311 people who are staff have not
Yes.
been trained. No one's been trained to deal with what we're experiencing right now.
Yes.
So
Yes.
no amount of training would be sufficient, but it would be
Yes.
a good start. And just to be let to know, this is very unique circumstance we're all living through right now. And the
Yes.
kinds of calls you're getting are the kinds of calls that would go through all kinds of other support networks, but 311's become the center filter. And they're life and death calls. So they're the kind of calls that we see that 911 operators, they are trained. They know that what their work schedule is. They're even
Mm,
assessed for their
mm.
capacity to do their job on a regular basis because they're in such threat of
Yes.
having issues, suffering from post-traumatic stress disorder, from
Hmm.
exposure to very traumatic events, even over the phone. And now 311 is crossing over into that
Yes.
territory.
Yes.
And
Yes.
nobody is providing those supports or recognizing what effect this is going to have. And they will eventually, when we see that the burnout is so severe that they just don't, there's staffing shortages. What we're seeing right now in healthcare, that's going to roll out into other sectors. So while we're seeing so much burnout in healthcare right now, because healthcare workers are like, they are champions, the way that they will just go through and keep going regardless of circumstance, regardless of what's going on. But they can do that for about 6 months, and we're past that mark now. And so while we thought, our healthcare people would be suitably adequately ready to do this, we're seeing so many people are sick, so many people are having to take time off, and we have a huge resource limitation right now, right? So similar to 311, we're seeing in all of our government sectors burnout,
Yes. It's
significant burnout, right? And a lot of people that are being brought in are people, while it's creating some job opportunities for people to do contract work, and it's hitting some of those vulnerable sectors, they are being overused and inappropriately used. So until they're going to burn out permanently and not be able to return to work. So, like we're really, really in a very, very sensitive place right now. And I mean, like you keep bringing back to students, they are such a vulnerable group, particularly displaced students who have come
yes.
here from
Yes.
other countries, and they're
Yes.
relying on our services and our supports. And we
Yes.
just don't have any kind of centralized model so that, we can reliably give them the best support at the right time that they need it. We're just not set up like that. I mean, today, the I probably shouldn't talk about this, but our Ontario government the auditor's report came out,
Yes.
and we are not faring well. Our response to COVID has not been
Yes.
strong, and the general auditor's report, while the premier is quite upset and pushing back and saying all 22 accusations are untrue,
Yes.
there are so many people that have suffered as a result of all of the things that were identified as falling short. And I mean, to add insult to injury, it was a clear indication that if we were responsive to the general auditor's requests after we suffered from SARS, then we wouldn't be in this situation right now. So I
You
was
know,
thinking that right before I came on today, right now, and I said, oh my gosh, shaking my head again. And I'm like, how we fall short for the people.
well, you know, um, so last night I actually got an email, a text, and it was a text, and in my so a friend said to me, Carol, a person that you know from UPSU is mother just passed away, contracted COVID from her. So she's a frontline worker, got contracted, came home, a big Filipino family. She got COVID. Her mother died from it. Children, all her children have it because they didn't know. Her husband is in hospital with it, and two of her grandchildren. It's like you're watching a whole family.
Totally.
And when I get a text last night, to be quite honest, I have not responded. They said, could you please send her a message just to say we're thinking about her, you thinking about her. And I don't know what to say.
I know. And you raised such an important point
I
about,
don't know what to say.
yeah. Well, I mean, and this commingling that we're seeing, they just identified this as one of the most crucial issues that needs addressing, is that in all of these vulnerable groups, you okay?
Hmm.
I know it's
I'm,
just
it just bring up, like
overwhelming. It's
I was
overwhelming.
reading, yeah, I was just reading the report you just mentioned, right? And I'm thinking, I have to respond to my friend. I'm going to respond to her. But what could I say when your mother tell your husband is in ICU? You are sick. And I'm going to send a tweet, a text to say, I'm thinking about you. When she will get that, like, what do I do? Does she need something? Can I send her a basket? And you think about all these things, but at the end of the day, when it hits you at your doorstep,
Yeah.
is how do you react?
And it doesn't hit people, individuals, it hits families. That's the point.
Families.
So
Yes.
every time we're in trouble and we're in crisis, we turn to our family. But this COVID-19 hits families. So there's no, and we're not allowed to reach out to any other supports right now, right? Because
Yes.
we're all so
Yes.
isolated. So when it hits, and it's hitting in racialized families, because
Yes.
they're multi-generational, they just talked about this 2 days ago on CBC. They said multi-generational homes are getting hit the hardest because we're
Yes.
seeing the biggest amount of transmission in the home. Why is it happening? Because they don't have enough space to separate. They don't have separate rooms. They are all together. The family members that originally get sick, they were never tested. So
Mhm.
because there was barriers. And so by the time they get tested, they've already exposed their entire family. So, and then they have no luxury of being able to separate when they are able to follow and get tested in a timely manner.
Yes.
There's
Yes.
no room for them to separate in a sufficient way to protect the rest of
Yes.
the vulnerable family members. And so then they end up getting sick, and then you do see deaths because you have multi generations living in the home. So you'll have parents living with the family, with two parents having children. So you've got like at least three generations in a home, and those older individuals are far more at risk of the side effects requiring them
Mhm.
to go into hospital. And then the stress of having to work in all of these compromised, let's put it this way, contractual sort of very transient kind of work environments with where the conditions are poor too. They are not healthy going into the pandemic. So they're not going to be healthy coming out of the pandemic, right? And we also see that there are also individuals that are suffering from comorbidities. So they'll have obesity, diabetes, they'll have hypertension, they'll have the
Mhm.
things that we are seeing are put people at significantly increased risk of requiring
Yes.
hospitalization.
Yes.
So yeah, we know that these are the things that will end up tipping the scales in favor of those people doing far poorer. And while you say what you're saying, this week we're on Wednesday, so I've already had 3 emails. One from students, two from employee people staff that I work
Yes.
with. Both of them, two staff have gone off. Both their parents have passed away.
Yes.
Two have lost both two parents, and
Yes.
then one of my students lost their father. And so, and at that point, I just throw my hands in the air and I'm like, you know what? You need to take time because you've just done so many
Yes.
months of a pandemic and now you're suffering a loss. It's like adding the worst kind of insult to an injury that is so prolonged. And we know when we look at caregiver burden, we look at how people will care for an individual over a long period of time. Usually,
Yes.
Alzheimer's disease is where we see our largest model. We see
Yes.
chronic and continuous responsibility and burden, how it slowly threatens the immune system's functioning. And what we often see is that within 6 months of caregiver burden relief, meaning that you no longer are a caregiver, you get
Yes.
so sick. And we
Yes.
have been in this situation now for 9 months. We're going on
Yes.
9 months. And we're slowly hitting that vulnerability mark where our
Yes.
immune systems are so compromised. So even if you live in a good condition, even if you have stable work, you're threatened right now, right?
Yes.
And that's barring we haven't gotten to the mental health and substance abuse issues, which we'll get to, but barring those, not even putting those on the table as potential coping mechanisms or outcomes associated with the pandemic, we're putting ourselves in a very, 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 very compromised situation right now. Everybody is.
And that lead me to the fourth question is like, what actions and integrated approach we can take towards supporting people living with mental health and homelessness.
Yeah. Well, the intersection of those two is
Yes.
particularly challenging to begin with.
Mm-hmm.
We've seen an escalation in homelessness. We have in Statistics Canada has not looked at the combination, but we
Yes.
know leading into this before the pandemic that homelessness was far greater in those suffering from mental health. So
Yes.
another way to frame that is that people with mental health are at increased risk of homelessness
Yes.
and increased risk, sometimes even related to the progression and the lack of treatment. So while I can identify problem after problem, the
Yes.
comorbidity of both mental health and homelessness is such an entirely huge problem. We're seeing that while we look at homelessness in older individuals, typically our demographic will fall over the age of 18. We're seeing an escalation in homelessness in younger individuals.
Yes.
So, and younger individuals who are suffering
Yes.
from comorbidities, and oftentimes it can be mental health. And we're seeing that to add all this together, that there's also substance abuse issues, and that will
Yes.
increase risk further. So that we're seeing representations of people that are both young, suffering with mental health and addiction, living on the streets. And the pandemic has worsened that. And right now, what we are offering is in the way of we have not increased our safe injection
Mm-hmm.
sites or our harm reduction framework because of
Yes.
COVID-19, I guess, has, particularly put people at risk. But places like Quebec have been very responsive. They've recognized that there's quite a significant population of people living on the streets with
Yes.
specific addictions, and they're adding in pop-up services and support and drop-in centers. So, and at the very least, they identified we're doing this because we're just, even if people come to keep warm,
Mm-hmm.
and then we have one access point to them so that we can then share with them other services. Because living on the streets, having a mental health issue, and comorbidity of having mental health and having an addiction, you're not accessing people. You're not coming in contact with people. And right now, during COVID-19, we're being told not to do that. And so
Mm-hmm.
these drop in centers provide an opportunity to exchange safely, but providing people with connections to those services, right? Because what we really want to do is put the people where the services are. And while we can set up so many things and be so responsive, what we're often seeing in our province is we're putting them in the wrong place. We're
Yes.
not advertising them. We're not accessing our target group. So you can have a program and have no participants while you have a disgustingly significant need because you're not matching these things, right? So the right people are not getting to the need. So while we're resurrecting all kinds of services and supports, we're not being timely or we're not being thoughtful in how we do this. We're not even putting them in the places where the people that need them the most. So the first barrier is access. They can't get there because there's no transportation.
Yes.
They lack,
Yes.
yeah, they lack because I know you're
Yes.
definitely an advocate of transportation in vulnerable
Yes.
sectors, and so you recognize too with all the decrease in the busing that we're
Yes.
seeing, and then they go and put a service in an area that has decreased transportation networks to it.
Mm-hmm.
So while you put these services in, then you have no way of getting there. So that's what we're seeing repeatedly.
And it's quite difficult even if you don't have the mental health
Yeah.
homelessness with all these eviction because evictions is still continuing.
Family evictions. So we're seeing homelessness
Family
families.
eviction.
It's not individuals anymore. It's families. It's families that are 6% right now. When we look at actual homelessness defined, they're at threat for homelessness. And these are families. So this is not individuals. The individual numbers are higher, yes.
Yes.
But when we look at families, we're talking about multiple people. So for one unit, you could be looking at 6 or 8 people, four, two, but it's more than one. So the impact is greater while the percentage is lower. The impact is greater because the unit is more. So, I mean, we're like, and again, we don't have, while Canadian Mortgage and Housing, CMHC, corporation has invested now, I think something like $1 billion or something, like a large amount of money. Could be $1 million actually. I think it's probably more like $1 million. That to start pop-up housing options, very quick, like immediate. Since the summer, they basically provided this relief. But these services are not going to be able to be in place, obviously, for this 6-month period where we're going to be most vulnerable and in a most risky situation, because homelessness in the wintertime in a country like Canada is so much riskier. And during a pandemic, as a further threat, we have seen a 3 times increase in our, I forget what they're calling them, but they're calling them these little pop-up camps that people are setting
These 10
up.
cities.
10 cities in
10 cities
Rosedale,
are increased.
in Moss Park.
Yeah.
I cannot tell you how they've been trying to eliminate them and then not providing any housing option for these people who are living in these conditions, which are extremely transient to begin with and so unsafe.
You know, I'm so glad you said that. Because when I go for my walks and I walk down the where I live and I go down to the brickworks, I start noticing when I'm heading to the brickworks, that wetland, lots of lights start coming up at night. Lots of, or like Juni days, because now you don't have the trees, leaves to cover, right? It's bare. I'm seeing so much tent.
Yeah, blue
all around the Via Bleu. When you hit in that area, I was like so surprised when I start seeing so many tents. So, but my husband started saying to me, I think there's a lot more people. I've seen a lot of these tents around the bridge, and by Castle Frank. And I keep saying,
yes, it is.
I don't know. I said, and then I start seeing them.
Yeah.
And then what happened was the weather was so wonderful. We had some really nice days. So I started to walk down just in the city of Toronto.
Yep.
And as I start walking all the way down to Dundas by the hospital, like Toronto Western Hospital, there is, across from Toronto Western Hospital, there's the library. Yeah. On Dundas West, there's a library. And then there's a big open park. That park had almost when I last checked, it had 41 complete tents built in that little packet. And somebody was just putting up a tent.
Yeah.
I go through that wetlands, that walkway, and I start going through the brickworks where if you go high up, you have beautiful homes, and yet you see the devastating poverty of young people living through in these tents.
Yeah, these encampments. They're homeless encampments.
And homeless encampments. I am very worried.
Oh, CBC identified this in August as a significant problem. They said we need housing to increase,
yes.
And now we're in the fall, and they just keep increasing and they keep increasing, and yet no response because everything's full. All of our existing infrastructure is full, and while we do these pop-up shelters, one opens, 2 close. One opens, one has an outbreak, then it gets restricted, so it becomes closed. So there's a rollover, but let's put it this way: we're not increasing. We change one for another, but we haven't increased. But what has increased is homelessness.
Yes.
So where are people going if there's no place for people to go? So and there's greater fear of COVID-19. So people do not want to go into shelters because they cannot be kept at a distance safely. So then they're living on the street as an alternative to try to be as safe as possible. I mean, if this isn't something the government needs to be responsive on, I don't know what is, because these people are actually trying to align with what the requirements are around COVID-19. And in doing so, they're ending up on the streets.
So some of our students, home near to Ryerson, there was a big building, I can't remember the name of the building, caught on fire. And many of our students was in that co-op. and they lost their apartment. So they had to move into the student resident. The university was kind enough to help them to move in temporary into the student resident.
Okay.
Right? Because Ryerson have emergency shelter, I think it's for 4 weeks. But one of the students said to me, I am having a problem because I can't find a room to rent.
Yeah.
And I didn't know that he was part of the unfortunate, his apartment was also hit with its fire in the building. And he said they're not going to come back in time after the holidays or anything. And he's temporary in Ryerson resident. And I just spoke last week to about 3 others that I had to find outside support finance for them. So I've been asking my friends and family to really help these students by opening up the purse and giving them some money for food and trying to make up the first and last rent. The need is huge.
Yeah.
And to not have a person that these students feel that they could go to, whereas for a big university who have some kind of obligation when the students pay for their services. These are full-time students that can't even run to their the undergrad union because it's not working at full capacity to help them. And these students and them that I spoke to are racialized students. They're Black and Indigenous students, and they felt like they're at a loss.
Yeah.
Right. And I'm feeling deeply hurt and moved because it's so much I could do. I am also seeing, because I look after our bursary, I oversee the bursaries and the emergency bursaries for CESAR, the kind of students is asking for help. It's like, I don't have furniture. I can't afford to buy a bed. I can't feed my kid. I really want to study because that's what I could do because I have the time. I'm not working, but I really need the help because I can't pay my food. I can't. It's always come down to a bill and a food, a
Way worse
rent.
than you would have seen before, right?
Yeah, a rent or the food.
Food and shelter.
It's like you can't do both. It's one or the other, one or the other, one or the other, one or the other. And these are life-changing decisions. And you look at it and you go, what could we do? We need to do more. These are our future. The young people, these students that is coming through this pandemic, these are the future. If we don't protect our future, where are we going?
Totally. I wanted to bring this to the vice provost's desk because I said, one thing I'm seeing from these students is such a sense of helplessness. We're feeling hopeless, right? Because as adults, we've never seen a world like this. No. And I was saying, how can we work to partner with these students in all of these individual program areas to partner with faculty in some way? That faculty is having all these needs they identify, right? We're saying, oh, we can't manage our kids because they're at home. We can't, blah, blah, blah. Not huge issues, but time management, burnout related issues.
Yes.
And I said, why can't we partner with ECEs, students? Why can't we let them partner with our faculty in some way, even individually with individual faculty members, so they can see, they can practice their skill set, social work, because there's so many kids that are going through this pandemic right now and they're so scared. And we have these students we're training with this skill set and we're not using them. We have them in courses doing all kinds of stuff where we could be tap into their resource. Not only would it help them to know that what they're doing and what they're training to do is going to be a need for the future, but it would also show faculty the benefits of our students. It's a bi-connected sort of system versus always we're saying we teach, we do, we give. But our students give us so much too. They have the potential to give us so much, but they're not being given opportunities to do that. I guarantee you, every time I reach out to my student group, I say, oh, I need X. They come back with Y, Z, and everything beyond that. But we don't do this. Departments don't reach out to their students. Departments don't, we don't tap into our own network of resources. We should consider our students as part of our huge cycle, our community. Students make up the largest part of our community, our Ryerson community. They're the most important part. They're the most essential part. So why do we have students that don't have any place to live? Why do we have students that are in threat and can't continue their education? Because like you said, it's either or, house or. I mean, we shouldn't have this situation if we identified the value in our students and we used it, because it is going to be a tough road for students ahead. And these will give them opportunities to recognize that what they're doing has value, what they're doing, there's a need for it, and what they're doing will create opportunity for tomorrow. And we're not spending enough time. And while I know that we've got 2 more minutes, our addiction rates or use of substances in individuals has gone up so much as a means to cope with this isolation and with this disengagement and with these threats to housing and food security. People are struggling, so they're using more drugs, and a lot of it is marijuana and a lot of it is alcohol that we've identified. And on top of this, we're seeing in youth an escalation in overdoses like beyond what we've ever seen. British Columbia has reported 2 or 3 times a day's increase in deaths from overdose, of which they're saying 2/3 of those are in that youth or cover that youth group up into 30. And it's because there's such a strong sense of hopelessness in individuals, and there's so much resource restrictions. So while they might not wanted to have done that, there was no service available. While we would have had access, there would be more safe injection site opportunities for them. Those are closed. Those opportunities are narrowed. And we're seeing 160. There's over 160 people for the last 5 months during this pandemic. A month have been overdosing in British Columbia. We're not even reporting our numbers here in Ontario. I don't even know what they look like, but they used to be quite comparable. That's ridiculously high. Way beyond our national average for this year is going to probably be 3 times. It's leveling up to be 3 or 4 times what it has been in any other year. I mean, it's ridiculous. I just
Well, so on that, I really want to give some kind of
hopeful.
We have touched on so many things, and I really appreciate your time here. But I have one quick question that I think you could answer in 2 minutes. What are some of your recommendations that people can do creating a social resilience in a time of the pandemic?
Well, I mean, one of the ways, obviously, we say that one of the biggest resiliency factors is continuing their education. So while they're in this, and particularly if they're in vulnerable groups, right, to break those cycles, they need to stay on the path to getting education, right? Because I mean, you and myself, we're both robotics, we're racialized, we represent racialized groups. And we both have seen the value. I know we've had unlimited amounts of conversations, me and you individually, how important it is that our children. Well, I say that to all youth. It's important for them to stay in school, but it's also important for them to use the modalities that are available to them to engage with other people, to create groups, which is much more difficult right now, I get, during this pandemic. It has been really, really, really difficult to reach out. And there's been so much restriction, but I force people, and I say this in my own lectures, that you need to make those connections, continue those connections. You need to put effort into connecting with people, whether that be your family or your friend groups virtually. I know we say you're supposed to limit your screen time. The other thing we're seeing a huge, huge decrease in is exercise. People need to get outside, and people need to breathe fresh air. And not just students included, but people who are putting those restrictions, like faculty like myself. We need to be far more empathetic to our students' needs. We can't go into this pandemic and see this pandemic through with these students if we are not compassionate and we are not understanding And we are not able to
Yes.
place ourselves in the shoes of our students right now and just how vulnerable that they must be feeling. We're in a totally different protected group with full-time employment. So it's very hard and maybe highly unrelatable, but that's something that we definitely need to have as far more compassionate and for each other as students. Students definitely need that far more as well, right? Resilience is built on these principles and having these kinds of networks and supports, right? We say the biggest resiliency buffer or factor is having networks, having supports, having a community that you can draw on. Ryerson should represent that community for their students, right? And should provide those supports. Plus, it's also looking into and reaching out to your services and supports, right? While you know they're there, many people aren't using them because they're way too busy. They're not finding enough hours in the day. It's essential that you do that because it creeps up on you. And before you know it, you've gone far too deeply into what you're doing to be able to pull yourself out and see the impact that it's having on you in a negative way. So I definitely recommend those things.
Thank you. I really, really, really appreciate your time and your brilliancy in just really breaking down these things for us. Thank you so much,
No
Dr.
problem.
Perek. Thank you, thank you, thank
Bye,
you.
everyone.
Really
Stay
appreciate it.
safe.
Bye-bye. Have a good
Bye.
evening.